Today our group will be discussing Polycystic Ovary Syndrome or PCOS, a hormonal disorder affecting many women of reproductive age. In our presentation, we will cover some key areas, which is what is PCOS and its complications, dietary interventions, challenges in managing it, and our final recommendations. Let's begin by understanding the basics of Polycystic Ovary Syndrome or PCOS. This is a hormonal disorder that is primarily affects women of reproductive age. It is one of the most common endocrine disorders, yet it is often goes undiagnosed. Key characteristics of PCOS include irregular menstrual cycles, elevated levels of androgens, often referred to as male hormones, and the presence of multiple small cysts on the ovaries, which gives the condition its name. PCOS is also strongly linked to metabolic issues like insulin resistance, obesity, and broader hormonal imbalances. These factors not only complicate treatment but also significantly affect a person's overall quality of life. PCOS can lead to several complications if not managed properly. One of the major concerns is for infertility, as irregular ovulation makes it difficult for women to conceive. Without irregular ovulation, the chances of pregnancy decreases significantly. Insulin resistance is another common issue, which increases the risk of developing type 2 diabetes. This can affect overall metabolic health and requires careful monitoring. Additionally, women with PCOS are higher risk of cardiovascular diseases due to factors such as obesity and high cholesterol. This highlights the importance of managing weight and managing heart health. Mental health is also affected, with many women experience anxiety and depression due to the challenges and symptoms associated with PCOS. And there is a higher risk of endometrial cancer due to prolonged menstrual irregularities. These risks emphasizes the importance of early diagnosis and effective management of PCOS to prevent complication and improve overall well-being. This develops as a result of combination of genetic, hormonal, and environmental factors. Some women may have a genetic predisposition to develop PCOS, meaning it can run in families. Others may be at risk due to childhood obesity, as excess body weight can exacerbate insulin resistance, or due to being small for gestational age at birth, which can also influence the development of PCOS later in life. One of the primary features of PCOS is insulin resistance, where the body's cells become less responsive to insulin. As a result, the body produces more insulin, which can lead to weight gain and further worsen the condition. Excess androgen production, which is common in PCOS, contribute to symptoms like acne, excessive hair growth, and male pattern baldness. These symptoms can cause significant physical and emotional distress for many women. However, the good news in the life is that lifestyle changes, such as balanced diet and regular exercise, can have a significant impact on managing PCOS. Diet can help improve insulin sensitivity, while exercise can support weight management, both of which are crucial for reducing symptoms and preventing further complications. In some cases, medication may be necessary to help regulate hormones and improve ovulation, thereby enhancing the fertility.
I'll be discussing dietary strategies that can support the management of PCOS. Let's dive in. First one is low glycemic index diet. This diet emphasizes foods that release glucose gradually into the bloodstream. By reducing insulin spikes, it enhances insulin sensitivity and helps combat hyperinsulinemia, which is crucial for hormonal balance in PCOS. Here are some examples of foods for a low GI diet. Grains and starch like brown rice and lentils, vegetables like broccoli, spinach, and bell peppers, fruits like berries, apples, and orange, and dairy products, nuts like almonds, flax seeds, olive oil, and avocado. The next one is Mediterranean diet. Mediterranean diet is a classic approach rich in fruits, vegetables, whole grains, nuts, seeds, and healthy fats like olive oil. This diet has been shown to reduce inflammation and oxidative stress, both of which are common in PCOS. It is also linked to improved fertility and better metabolic health outcomes. Third one is high protein diet. A high protein intake can boost satiety, supporting weight management, an important goal for managing PCOS symptoms. It also improves insulin sensitivity and lowers androgen levels and addresses key hormonal imbalance. For those who are overweight, a calorie restricted diet focuses on weight loss, which can significantly improve hormonal profiles and promote menstrual regularity. Next is DASH diet. The DASH diet, which stands for Dietary Approaches to Stop Hypertension, is rich in whole foods and emphasizes fruits, vegetables, whole grains, lean proteins, and low fat dairy. It is naturally low in refined sugars and unhealthy fats, making it highly beneficial for PCOS management. DASH diet improves insulin sensitivity and it supports weight management, reduces inflammation, and also it regulates hormones by minimizing sugar and insulin spikes. It also enhances heart health, lowering blood pressure and cholesterol. Next is anti-inflammatory diet. Incorporating anti-inflammatory foods like fish, flax seeds, and leafy greens rich in antioxidants and omega-3 fatty acids can help reduce inflammation. Inflammation is a key factor in the pathogenesis of PCOS. Low-calorie ketogenic diet emphasizes a low carbohydrate, moderate protein, and high fat intake to induce a state of ketosis, where fat becomes the primary energy source instead of glucose. It is calorie restricted, making it an effective approach for weight loss and enhancing metabolic health. By focusing on both weight management and metabolic function, this diet is particularly beneficial for managing conditions associated with PCOS. This diagram illustrates the effects of low-calorie ketogenic diet on adolescents with PCOS. Key benefits of low-calorie ketogenic diet include weight loss and body composition improvement, lipid profile improvement, reduction in insulin resistance and oxidative stress, improved menstrual regularity and reduced hirsutism, lowered androgen levels, and improved ovarian function. Long-term adherence to the low-calorie ketogenic diet can be challenging due to its restrictive nature. To ensure safety and nutritional adequacy, ongoing nutritional counseling and careful monitoring are essential.
Finally, recommendations for managing PCOS through dietary interventions are as follows. First one is adopting a balanced diet. This includes a variety of whole foods with a mix of carbohydrates, proteins, and healthy fats to support overall health and hormonal balance. Second, increasing anti-inflammatory foods. Foods like leafy greens, berries, fatty fish, and nuts will reduce inflammation linked to PCOS. Third one, fiber-rich foods. So focusing on fiber-rich foods like whole grains, beans, and vegetables can help regulate blood sugar and improve digestion. So the fourth one is calorie restriction. One can aim for a moderate calorie deficit If weight loss is recommended, as it can improve symptoms and insulin sensitivity. Fifth one, supplements. Nutrients like omega-3 fatty acids, vitamin D, and inositol may help improve hormonal balance and metabolic health. Sixth one, avoid processed foods. Such foods may include like the foods which are high in sugar, unhealthy fats and preservatives, as they can worsen inflammation and insulin resistance. And the last one is seek professional guidance. So, working with a dietitian or healthcare provider can create a personalized diet plan that fits your needs and goals. To conclude, PCOS or Polycystic Ovary Syndrome is a common hormonal disorder in women of reproductive age. It is caused by hormonal imbalances, insulin resistance, and sometimes genetic factors. The main symptoms of PCOS include irregular periods, excess androgen, and polycystic ovaries. So PCOS itself is a complicated disorder, so it can best managed holistically. So for managing PCOS, keto diets with less calories may assist with weight, hormones, and insulin resistance. Personalized diets focusing on lower carbs, more fiber, and balanced nutrients can aid metabolic health and fertility. Including supplements such as vitamin D and omega-3 fatty acids in the diet increases the effectiveness of treatment. Being physically active on a regular basis is crucial for PCOS management, and long-term success requires knowledge, support, and sustainable lifestyle modifications. Thank you for your attention.